9.1 FM.
Herbie's 99.5 FM. Kaieteur Radio. This is the news on top of the hour.
Live from our studio in Georgetown.
Kaieteur Radio, 99.1 FM.
Kevin Smith here with your news in capsule. Amid mounting criticisms of the government's failure to audit the $10 billion expenses by ExxonMobil for the Liza 1 and 2 projects, Kaieteur News publisher Glenn Lal has estimated that the money forfeited could have doubled public servant salaries at its current rate for the next 6 to 6 years. This likely lost income is linked to a provision in the production sharing agreement, which gives the government a chance through periodic audits to reclaim excessive spending by Exxon and its partners. This provision was to ensure that Guyana could get the maximum benefits out of the contract with Exxon. In other words, it was a safety valve for the financial protection of the people of Guyana. Government had a duty to use the safety valve when needed. In other news, amid a shortage of fish here, supermarkets are now stocking their freezers with imported fish and shrimp from Florida and Jamaica. And while local fishermen have sought to blame the situation on ExxonMobil's ongoing oil operations in Guyana's waters, the American oil giant has downplayed this, saying impacts from these operations on maritime life is minor to negligible. Visits to supermarkets in the city have revealed that a number of supermarkets are stocked with imported seafood. When the first 6 months of 2019, 2020, and 2021 were compared, it was revealed that for the past 2 years, fish and shrimp production has been declining. This was seen in the recent Bank of Guyana half-year report.
And that's the news of the moment. Remember to get the full details of these stories, pick up a copy of the Kaieteur News. And don't forget, you can catch us on the MyTuner app as well as the Radio Garden app. You can also keep up to date by liking our Facebook page at Kaieteur Radio and subscribing to our YouTube channel, Kaieteur Radio Livestream. Oh, also catch our stream at www.kaieteurnewsonline.com/radio.
Keeping your hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. So be wise and wash your hands regularly to keep those germs at bay. Get more tips for healthy living by tuning into Kaieteur Radio every Monday at 1:05 p.m. for Your Health Matters.
Hello and welcome to another edition of Your Health Matters here on Kaieteur Radio. I'm your host Rihanna Ramsey, and joining us today is Miss Ramona Chandabali, a cardiac sonographer at the Georgetown Public Hospital Corporation. She's also the Vice President of the Guyana Association of Medical Imaging Practitioners, GAMIP. Ramona is joining us in studio to talk about the role of radiographers in the pandemic. Our discussion follows World Radiology Day, which is observed on November 8 every year. The day marks the anniversary of the discovery of X-rays in 1895. World Radiology Day is celebrated to raise awareness of radiographic imaging and therapy, which play an important role in the diagnosis and treatment of patients, and most importantly, ensuring radiation is kept at the minimum requirement, hence improving the quality of patient care. Ramona, you would agree with me that radiographers and other medical imaging professionals are among the key support staff at hospitals and medical facilities. You could explain a little bit more as it relates to what that really obtains, what that role really is. So go ahead, Ramona, and good afternoon, and thank you for joining us.
Thank you for having me again. It's always a pleasure to be here.
Yes.
We are the eyes of medicine. I guess is the quickest way to sum it up. Mm-hmm. We provide vital information for doctors to make a lot of their decisions. Whenever you come into a hospital and you're admitted, one of the first tests we'll do is a chest x-ray. And depending whatever else the doctors are looking for, you'll have other imaging modalities being used.
Yes.
You'd probably have a CT, an ultrasound, not an x-ray if necessary. And this information helps the doctor to figure out what type of medication you need, what treatment plans you need, if you need surgery, if you need to be hospitalized, be treated, and if you can go home. It basically helps them in their decision making on your treatment.
And in terms of studying, what education, you can speak to that. What obtains what certificate, how many years you have to study in order to become a radiographer. Actually, this is one of my favorite topics recently. I am beyond proud to say that Guyana now offers 3 levels of medical imaging education. We have the X-ray technician training course from the Ministry of Health. This has been running for quite some time. At one point, the country only had X-ray technicians because the UG degree program had some issues running for that period of time. So it's I believe it's 13 months now, or 18 months, I'm not sure. But when I did it, it was 13 months. This was when they had initially revamped it in the mid-2000s. And it's a certificate in radiography awarded from the Ministry of Health through their educational arm. You're able to perform basic X-ray examinations with this. You're able to function somewhat independently, but there are certain procedures you cannot perform without a radiographer. And that brings us to the bachelor's degree in medical imaging. This was reintroduced, or I should say introduced, because there was an associate degree before at UG. Now there's the full bachelor's degree, and this was launched in 2013. I was actually one of the first batch of persons to join this program. It's a 4-year bachelor's degree. Also, a bit of a fun fact. It's the equivalent of the US degree, so you can actually be accepted with this degree to study for a master's or graduate studies in the US once you qualify. It's 4 years of intense studying. There's a lot of physics. It's mostly the basic requirement for UG entrance, but if you have the X-ray technician program or the associate's degree, you're allowed to enter. And in the case of the associate degree, you complete the final year and you upgrade the associate to the bachelor's. If you're an X-ray technician, you still have to go through the regular process, do the full 4 years, to get the degree. So far, we've graduated around 4 to 5 years of students. So that has a huge impact on the type of services we're now offering in Guyana. And a few years ago, the Guyana Program for Advancing Cardiac Care had introduced the adult echocardiography program. This year, it was run for the first time through the University of Guyana. It's now a postgraduate diploma in adult echocardiography, which is a massive step forward in the right direction for Guyana. We're the only country in the Caribbean that offers this program. It's huge because it now puts us at a graduate level for education. So I've completed all 3 of them, all on Guyanese soil, all done right here. I didn't leave the country at any point in time. And that I consider is a massive improvement for both education and medical imaging services in the country. Okay. But I know that we have a small group of imaging practitioners. How many of them are radiographers, can you say?
I think in total we have about 60 persons. And oddly enough, now the bulk of that 60 persons are the bachelor degree holders, because every year we graduate around 10 persons since the university program has been launched. So we actually have less X-ray technicians and more radiographers, but it's still a very small number. We're still a far ways off from meeting Guyana's medical imaging demands.
And how many, could you put a number to?
I think we have close to maybe 30 to 40 radiographers right now.
And medical, in terms of the society, medical imaging, how many?
Yeah, that's closer to 60 in total.
60.
Yeah.
Okay. So we're talking about your work, how the pandemic has affected your work, and we want to have you touch on how being in this pandemic has affected in the performance of your duties. I understand that there's some backlog as a result of what went on earlier with the lockdown and so on. So can you speak to that a little bit?
Yeah, I was actually on World Radiography Day. I was basically reflecting on how the pandemic has been, and it was literally one day we heard rumors of a global virus being spread across the world, and the next day we woke up and we were in the middle of a pandemic. I'm not sure if scramble is the best word, but we were not prepared at all. We've never had a pandemic in our lifetime. I think the last thing was the Spanish influenza. I don't think that many persons are alive to even remember that.
Yes, I know.
And the technology has changed so much. There's more persons moving around, so it's a lot harder to contain. Yeah, we just woke up one day in a pandemic. We didn't have as many masks because we never really needed masks before. So the day, I believe it was the night before, the patient was tested and she passed, sadly. So the next day, we knew we had a positive case for sure in the country. So we had to start canceling patients. Any outpatient was actually canceled initially. And we were only seeing inpatients. And even at that, we were very cautious because our lab is, it's for everyone. Babies, young kids, teenagers, adults, persons who are on chemo, persons pending transplant surgery, kidney transplant. So we didn't want to put anyone at risk, at an unnecessary risk for getting COVID in our lab. So we prioritized who were coming in. Prior to that, we also had a priority list on who would get their echoes. So we had to cut back even on that. So like many of the clinics and the services that were being offered, we have a big backlog. We're trying to actually address that now as restrictions are being eased. But at the same time, it's not easy because some of the patients would have had COVID as well. So we're trying to work around when they're COVID free to actually come in.
And in terms of, I know that a number of health workers were affected with COVID. Some of them even got infected with the virus. But I'm not sure how the medical imaging professionals, how they were affected. Could you speak to that? And did you lose anybody as a result?
Thankfully in Guyana, no one. We haven't lost anyone, but globally, it's a very small community, even globally. So we knew when someone passed from COVID. The US has probably seen the biggest numbers. They ran out of PPE very early on, and they had to work with what they had. So a lot of radiographers actually passed in the US, in parts of Europe as well. But I think it was mainly like older persons. A lot of persons actually came out back and volunteered. In Guyana, a handful of persons were infected, but they've recovered well, thankfully. This happened partially because we do see patients with COVID-19, and you can't test every single person that comes into the hospital. And you still have to live. You still have to go about your day outside of work. So a few persons caught COVID-19, but they recovered well.
Thankfully.
Yes.
And we know that a lot of us in all the various sectors, we have to do things differently because of COVID. Could you touch on some of the specifics for your field, some of the things you're doing differently because of the pandemic?
One of the things we were joking about, a few colleagues of mine, we wear a lot of lead aprons for the radiation that we work with. So actually the PPE was a lot lighter. So it was like, this is easy. I still wear isolation gown, gloves. Well, everyone has their mask on, and I have a face shield. And I have not relaxed that since the first day we were dealing with the pandemic. Simply because you never know which patient might possibly be positive.
Yes.
Some patients don't test positive right away, so it's just a precaution. Because I'm not only am I at risk, but I'm also at risk for giving one of my patients COVID, and that's not something I want to ever have possibly happen. But everyone still wears a decent amount of PPE. It depends on the levels. So when we see a spike, we put on more PPE. Versus as right now, it's kind of plateaued. So we're not wearing as much as before, but we're still taking all precautions.
We know that there's stress, a level of stress that comes with your work. Doctors and nurses have spoken about it. I've had Dr. Box on here, and he talked about the stress, especially at the emergency unit. How do you handle that level of stress that comes, especially when the added stress that comes along with dealing with the pandemic? How do you deal with it?
I think probably because I'm over in cardiology more than I am in radiology. there are a few things that are very different. So you have to pace yourself a lot more. I think the one thing that was very disheartening was how fast patients were dying. I don't think no one thought we'd reach numbers we are today.
God.
I mean, one of the estimates say we'd have 8,000 cases. Now I think we're closer, or we've surpassed 20,000 cases, and we're on our way to nearly 1,000 deaths. So those numbers, they do affect us, because at the end of the day, these are patients we've known. Sometimes they might have come to us for something else, and then they got sick and went to Ocean View or so. Definitely pacing yourself, knowing what you can handle and what you can't handle.
Yes.
There are days when I've had tough patients and I just had to step back and take a break. Talking to my friends and family has helped. And yeah, we have that backlog that I was talking about earlier. We're going to try to get to everyone, but there's only so much we can do at the end of the day, and you can't beat yourself up for that.
Could you speak to the number of cases, patients that you have, or I don't know what your list?
As in the backlog?
Yes.
We're not sure.
Wow.
The thing is, we're basically, a lot of clinics resume now that patients are allowed to come back into the hospital, the outpatients in particular. So we're now following up on a lot of patients. What happened was some of these patients would have had previous studies. So we have a computerized system now, so we're able to track patients. So any patients with recent studies, they can wait a little bit, versus new patients who've not had anything recorded with us. And with more surgeries resuming again, we have more patients coming in. So we're trying to make sure everyone has their echo clearance so they can have the surgery. Our chemotherapy patients are priority. We make sure they have their echoes so they can resume, or if they need to change medication. All of our maternal patients have always been top priority. That will never change. As soon as there's a maternal patient that's either urgent or immediate, we try to get that done. And we have all of our cardiac surgery patients. We make sure we track them appropriately. And there are a few patients who would have had kidney transplant we also track as well. But other than that, the non-urgent patients, we have them triaged by our cardiologists. So we fit them in as often as we can, but we still try to prioritize the persons who need the echoes more urgent. As for radiology, we try to get the critical ones done, and it's a 24-hour service, so they don't have the limitations that we have.
Okay. We know that there was some protocol that you developed as a result of what's going on. Tell us a bit about what you've done
So
differently.
there are two sets of protocols. The American Society of Echocardiography had developed, I don't know how they did this. It was like really fast. Like we went into lockdown and within 2 weeks we had a protocol. One of our cardiologists from Canada, Dr. Isaac, did a modified version for our lab. So we've been following that since then. And the ISRT, the International Society for Radiographers and Radiological Technologists, they did a whole document on all of the imaging modalities, how to triage the patients, how to monitor your waiting area, how to schedule patients, how to clean the equipment, what to do in the event that a positive patient accidentally came in, because that has happened.
Wow.
All of that is there. It's I think it was adopted by WHO as well. So all of that we've been using to make sure we make it as safe as possible for patients to come in and access these services.
Okay. You said that there was this happened before a patient who was positive accidentally came in.
It's happened a few times. So a lot of patients might have an antigen negative test, but they're PCR positive.
Wow.
So that happens. It's why we wear as much PPE. It's why we advocate for persons to keep wearing their mask even though they've been vaccinated. Because not everyone is vaccinated, so you don't know what risk you're facing every time.
Wow.
But it's not very frequent. It's very rare that happens. But we have a protocol in place. We disinfect right after that patient, clean down everything, and the doctors follow up with that patient to Ocean View.
All right, we'll just take a short break, and when we come back, we'll hear more from Ms. Chandabali, Ramona Chandabali, a cardiac sonographer attached to the Georgetown Hospital. She's talking about radiographers and how their role in the pandemic and how they're able to safeguard themselves and so on. So when we come back.
Getting vaccinated is important in protecting yourself and those around you. The COVID-19 vaccine is not a cure. The Ministry of Health's vaccination drive is to remove the virus's ability to cause hospitalization. It helps to look at your exposure to COVID-19 like this. Best case scenario, you don't get infected, and the worst case scenario is death. Get vaccinated today. This is a message from Guyana's Ministry of Health in collaboration with PAHO WHO.
Welcome back to your Health Matters here on Kaieteur Radio. We are talking to Miss Ramona Chandabali, a cardiac sonographer attached to the Georgetown Hospital. She's speaking to us about radiographers in the pandemic, the role that they're playing, and for those who don't know, a radiographer is a medical imaging practitioner, and they have a very essential role in helping patients, doctors and nurses, in terms of finding the correct diagnosis and treatment for patients. They do all the x-rays and the imaging, all the stuff that that's an area, very technical area that doctors cannot focus on because they have a lot of other issues that they have to deal with. So they are very, very important, and we're talking to Ms. Chandabali about what are some of the challenges that they're facing right now given the COVID-19 pandemic. Before we went to break, we spoke about a lot of stuff, but going forward, I know you recently made a presentation at a forum, a virtual presentation, where you spoke about having to develop a strategy to deal with issues like these, like a pandemic, or let's say we have an outbreak of some sort, that you will have that strategy in place so that if that happens, you're able to go forward and address it properly. Because I mean, the COVID-19 pandemic came out of
pretty much nowhere.
Yeah, nowhere. Yeah. So,
we were blindsided by COVID, and I think it wasn't just us alone. Even some of the developed countries.
Yes.
I think as we were watching it play out, not that many persons were expecting it to happen the way it did. All of the waves that we saw, what happened in Italy, Brazil, India, and the US.
Yeah.
One of the things for radiography, because like you said earlier, the first X-ray was literally taken in 1895. We're only like 127, 26 years old since the first X-ray. Mm-hmm. You went from a very grainy, horrible image to you have 3D cinematic rendering where you can subtract everything. You can see it's almost like real bones and everything.
Yes.
So what we didn't factor in, and I guess simply because we don't have these outbreaks like other parts of the world, is how imaging plays a role in all of this. We have a lot of handheld bedside ultrasound units that doctors use, which is excellent, and we use them here in Guyana. They provide critical information in how this patient gets prioritized for certain exams and tests and stuff. But at the same time, the field itself needs to have a plan. If we have an emergency, a national emergency, or like an outbreak like COVID, how are we putting things in place from an imaging perspective? And that's something we definitely have to work on. I know parts of Asia have an excellent model. Singapore was ready and just waiting because they've had the previous outbreak. I think they did have some MERS cases and the original SARS. Yeah. Mm-hmm. So they were prepared, but we weren't. It never reached us before, and now with oil and gas and an influx of so many international persons being in the country, we have to cater for the fact that movement is going to be significantly faster than it's ever been. Mm-hmm. I think the world started to go into lockdown. We started following COVID in December of 2019, and by March we had a confirmed positive case. So that was a pretty short time. Usually pandemics would just miss us entirely.
Yes.
Yeah, it never happened. It never reached here.
I often joke and say Guyana is we kind of invisible on the map to certain things, and we gotta be grateful. But
it's changing now. It's no longer that's no longer what's happening. But yeah, definitely. And it's not just imaging. I think all of her services that we provide for the country should have a plan on what to do. Definitely get stakeholders from the field, persons who've worked in this pandemic, and prepare, because one of the biggest conversations globally, and this is, I'm both a member of the ISRT and the American Society of Echocardiography. This is a topic that comes up in every conversation you have, every forum. You have to prepare for the next pandemic, because we saw the gaping holes in our delivery of services, how badly we were unable to reach our patient needs. And we can't continue like that. It has to improve. Plans have to be drafted and put into place, and they have to be functional. I think we weren't able to offer imaging services at Ocean View until a few months after we've been admitting patients. And that's kind of bad, because you're looking at lung changes, you're looking at cardiac changes, and these are things that affect the patient on if they need to be on ventilator sooner or later, in addition to your clinical information. So these services, we have to factor in that you will need them moving forward. It's like we were talking about earlier, imaging is the eyes of medicine. Doctors can make certain calls without knowing what's going on inside of that patient. And we can't cut a patient open to look, hey, let me go look inside your chest, see what's going on. Let me cut you open.
Exactly.
So we need to factor in that this is going to be a major player moving forward.
And I know that you, in your field, there's some training involved. How do you see the need for continuous training in this regard, in terms of developing a strategy going forward and stuff like that?
Yeah, we were definitely blindsided by all of this. I've never done this level of infectious training. The most we've had is probably an active TB patient, where you just wear N95 and you put on an isolation gown. And usually these patients are on treatment, so it's a very low risk. But with what was going on with COVID, the amount of PPE we had to wear, how to properly put it on, take it off. We didn't have mask fitting. We don't have mask fitting again, which is bad, because if your mask isn't properly fitted, you have leaks and you can have the virus come into the mask. I think many of us are still adjusting to wearing the full hazmat suit. Thankfully, I've never had to get into one. But I was actually having a conversation with a nurse that worked at Ocean View. She was one of the first nurses there, and she said she volunteered for the vaccine and stuff, did everything right. And she was telling me that at one point she was wearing a Pampers, because when you're in that hazmat suit, you can't come out of it until your shift ends.
Wow.
So I think the nurses were on a 6-hour shift. I think people don't understand that. When you have on that hazmat suit, you can't eat, you can't drink, you can't use the washroom, you have to stay into it, you can't take off any of it.
Wow, I don't believe people know that, and I think you should.
And doctors and nurses have warned us for hours on end.
I think you need to repeat that for those who don't understand, that you need to get vaccinated. We're in studio, but we're practicing. We're both fully vaccinated. We're practicing social distancing. Ramona has on her mask and so on. I'm not wearing a mask because it kind of cuts my my speech, but I usually put on my mask, and that is the thing. You have to, because you don't understand the struggles that not just the medical imaging professionals, but the doctors and nurses especially. Ramona is saying that 6 hours they have to wear a suit, and they can't go to the washroom, and they can't eat, and they can't drink for the 6 hours that they have on the hazmat suit.
And you're sweating a ridiculous amount. Because I wear an isolation gown. I have my AC on a specific temperature for my equipment, and I sweat through everything that I have on.
Wow.
So, and I'm not wearing that level of PPE that they're wearing. A lot of persons had a lot of opinions about wearing the suits. But the thing is, it's also not sustainable. That's not how we work. It went from only using it with COVID patients to the point where many of us had to wear that level of protection.
Wow.
It's not sustainable. There are actually studies that are starting on the level of pollution that this pandemic has caused. Because when you're done with that, you have to throw it away. Nothing is being reused.
Yes.
The good thing is, Guyana was one of the lucky countries to have enough PPE throughout this pandemic. We did not run out. So we were very lucky in that regard. But it also meant we had enough PPE to discard of. And it's creating a massive
these masks, these surgical masks, and the material that they're made of, I don't think they're biodegradable.
I don't. Yeah, that's why persons recommend. In some cases, you can use a cloth mask if you're not comfortable with these. But I work in healthcare. I have to wear these, and they're wrong. I mean, you can walk down the street and find it just discarded somewhere. But yeah, our hazmat suits are made out of plastic. Some of the isolation gowns are plastic as well. And it's not going to just be incinerated, or it's not going to disappear. It's going to stick around, and it's just going to cause a lot of pollution.
Okay. So I hope those listening understand the challenges, how hard it is, and how difficult, not just for people in the medical field, but those of us out here who want to, look, Christmas is coming up, and if we had maybe the amount of the kind of reception we wanted with the vaccination and stuff, probably would have been actually out of the pandemic and we would have been free to do certain things. But you still have to practice some level of precaution because most persons are still hesitant about taking the vaccine. And so the Christmas that we would have been looking forward to, we can't go certain places and all of that still because of what's happening.
I am happy we reached 50% fully vaccination, but we still have a good ways to go. The thing is, if you don't vaccinate enough people, you will have mutations.
And that's what people don't understand, that viruses, not just this virus, every virus, they tend to adapt and change,
mutate into something stronger.
It's like changing to the environment or to whatever defense
basically
you put
it
up.
tries to live and thrive.
It's trying to fight back. So you still have to, whatever is being recommended, try to do your best to get that done so that you can be at a level where you can develop herd immunity, where a lot of outsiders and international people are talking about herd immunity. This is something that we need to, everybody get an immune booster. Where you,
one of the countries I was actually reading about and I've been following closely is Singapore. They have an amazing healthcare system. They're actually now offering a booster shot to the elderly. I suspect soon they're going to, and immunocompromised persons. So like in the US and Canada, they've done trials on persons who've had transplant, because remember, they do more transplant surgeries than just kidneys. So they have found that offers a higher level of protection. Some places are now even saying that if you've had a transplant, you're not considered fully vaccinated until you've had a third dose. And what was amazing, because Singapore hit herd immunity, I think, in September, and there are millions of people. So they hit that 70% fully vaccination. And what was amazing was in October, their ICU admission was 1. Some days they didn't have any. Some days it was like 3 or 4.
That's a dream for us here now.
Yeah, because I think we have about 19. I can't remember how much it was last night, but that's what herd immunity looks like. Their deaths are significantly lower as well. And they now have enough vaccines to give to the most vulnerable as a booster shot. And all of this is being published by their Ministry of Health on Facebook. You can Google Singapore Health. You can find it there. You can track each and every country on Facebook now to see what's going on. Jamaica started their vaccination late, and they ran out of oxygen, the whole island. And it wasn't just for COVID patients they ran out of oxygen for. They ran out of oxygen for surgical patients. Any emergencies. So let's the simplest example, you had an accident on the road. This has nothing to do with COVID. You go into the hospital, they can't perform surgery because there is no oxygen to put you on whilst doing the surgery.
Because the COVID patients are using
it's used
oxygen.
up all. So that's like a crisis situation. Thankfully, it only lasted, I think, a weekend, and they got that sorted out. But imagine that happening in Guyana. That's not someplace we want to be. And I was actually jokingly telling someone, you really trust our healthcare system to not be vaccinated? I know that sounds bad, but you generally have to have that level of trust to believe that if you get COVID without the vaccination, that you're going to be safe.
We talking about that. What role has the we went off topic a bit, but we're still talking about health. Radiographers and medical imaging professionals played in terms of getting persons, encouraging vaccination.
So the first day the vaccine came, I went and got it. It was initially like, I think in the first few hours, they had, I believe it was a pharmacist or a nurse who got the very, very first dose. Then my boss, Dr. Carpen, got his, Dr. C. Prasad, the senior doctors. Then afterwards, other doctors, because they're performing surgeries, they're working with patients, so they went and my direct boss, Dr. Chin, was like, you can get your vaccine. I'm like, yes, I'm going. So I went and got it right away. As they expanded it to both the private and public sector, most, if not all, of the government executive body got that vaccine within the first week. we all were fully vaccinated in our first batch, and we were all encouraging persons to get vaccinated. I posted everything on my first dose, my second dose. I think up to a week after, I was still sharing what was happening. But I was a bit smart about it because I knew I had taken my hepatitis shot, I think a year before that, and it's 3 doses. And I learned with vaccines, if you're feeling sick or if you're feeling weak, your body it will fight. It won't respond the same way. So I made sure I ate right. I got enough exercise. I was hydrated. So I had minimal side effects. The most thing I felt was a little bit exhausted. I had a slight chill for a few hours, but other than that, no other symptoms. And the second dose was the same thing. I made sure I timed it perfectly so that when I had the vaccine, I had minimal side effects.
So, and given you're on the radio now, you could probably tell persons about a little bit of a wide issue you could probably advocate if you wish, and then we'll go to a short break.
Okay.
And when we come back, we'll talk more. So go ahead.
Yeah. So one of the things I actually was telling someone was that your vaccine puts you in a position where you can walk out of a hospital should you get COVID-19. Versus if you're not vaccinated.
But it helps.
It helps. It gives you a barrier of protection that you need. I have seen patients. So at my hospital, we do not see COVID positive patients intentionally. We've had patients who've had COVID. It's a well-documented history. And they come and they have post-COVID-19 syndrome. It's just as bad as COVID itself. We've lost a few patients because of that. And this is a documented known history, and most of them were, if not all of them, were unvaccinated. They developed clots everywhere, in their lungs, in their heart, in their legs. A patient actually came the other day, and his fingertips were black, and he had to go and get them amputated because he had COVID, and he had small clots whilst he was having COVID. So they made sure he recovered, and he was well enough for surgery, and he had to amputate like 2 fingers, the tip of it, because COVID caused small clots there. And he was unvaccinated. So the thing is, the vaccine gives you a level of protection we can't provide, and we will never be able to provide. We'll try to meet your medical needs should you get COVID as best as we can, but we can't do the same thing the vaccine is doing.
All right, we'll just take a short break. We're coming to almost the end of the program. We have Ramona Chandabali, a senior cardiac sonographer from GPHC. She's talking to us about the role of radiographers in the pandemic. When we come back, we'll hear more from Ms. Chandabali.
Kaieteur Radio, keeping you informed.
Demerara and Essequibo 99.1 FM.
Burby's 99.5 FM. Kaieteur Radio.
Welcome back to the program. You're listening and viewing, those of you on Facebook, Your Health Matters here on Kaieteur Radio. We are talking to Miss Ramona Chandabali. She's a senior cardiac sonographer at the Georgetown Public Hospital, and she is part of the Guyana Medical Imaging Professionals Society, and she is talking to us about the role of radiographers, which is an important and essential medical worker in this field, and she's talking to us about their role during the pandemic and how it has affected them. Before we left, we were talking about some of her personal experiences as a medical imaging practitioner, and one of the things she mentioned is that you have to deal with different looking at images for different types of illnesses, but there are certain organs that you have to look at when you are dealing with COVID-19. Could you tell us a little bit about that, some of those organs and why, how that is done?
So we definitely have to do chest x-rays. We look at how the lung scarring is progressing with COVID. So you're going to have a ton of chest x-rays. It's one of the very, very first tests. It probably, if you come to East Street GPHC to be triaged, you might probably have one done right away. Once you're admitted to Ocean View, you will have serial x-rays done to track it. Post-COVID-19 patients are having CTs done of their lungs because they're no longer infectious. We only have one CT unit in Georgetown, so we can't risk having infectious patients there. So or they'd recommend that you go privately if it's booked out. And we're tracking all that lung scarring to see if it's progressing, if it's healing, and the doctors are making decisions based on that. Now, for us on the cardiac end, that information is vital because you can have right heart failure. It's very similar to what's happening with TB patients. When the lungs get overwhelmed, when it's not getting to produce enough oxygenated blood for the body, it puts pressure on the right heart. And that in turn can cause right heart failure.
Yes.
So your pulmonary pressures will increase, and now the right heart has to work harder than it should be working in order to get the blood oxygenated in the lungs. So you can have relatively normal left heart function, as in you don't have typical heart disease, so to speak, but you have right heart issues secondary to your COVID diagnosis. So we actually have a spirometry clinic at GPHC that's following COVID-19 patients, post-COVID-19 patients. If you're still experiencing shortness of breath and you're still feeling like your heart is racing post-COVID, you've recovered, you've tested negative, you should probably consider joining that clinic.
That's for long COVID.
Yeah, that's long COVID. And we're seeing a lot of persons. And sometimes even with that, we're also seeing left heart issues on patients who've never had heart problems before.
Okay. And that's as a result of the
COVID.
virus.
Yeah.
They develop other issues, complications.
Yeah.
Yes.
We actually have seen patients with clots, very young patients, in their left heart, which is full-blown what we call normal heart failure.
Wow.
So the heart's not squeezing, there's a clot in there, and we have to track that patient. And we have seen this in at least, I think my youngest patient was around 13, and we had a guy who was 33. It's very young persons, and they have no history of heart disease in the past, no family history that would indicate this is existing.
Wow.
We even have patients we're tracking who we have previous echoes for, and we're seeing what changes are happening.
You spoke earlier about your connection with the International Medical Imaging Society. Tell us a little bit about that and how their support has helped you throughout the pandemic. And then we'll talk about GAMIC and some of the work you're doing here before we close off.
Yeah. So the ISRT has been amazing in helping us keep morale up. It's been a wonderful place to share stories and to encourage others and to see how practices are working. Whilst we might have like a model document or a guidance document to work with, we're seeing like other countries who've had worse scenarios, how they've managed to cope with it. So it's not like the world is so disconnected. When something's not working, we know that's not working, so we don't have to go that route. We can find another option. With the ASC, they have been amazing in providing resources and research documents to guide us with our protocols. They've helped us to establish how to do echoes and when to do echoes on post-COVID-19 patients, especially those who might need it. We don't want to do the echo too soon or too late. We want to make sure that if this person is to have cardiac changes, we'll know when to do that echo in the right time so they have the right diagnosis.
And in terms of, we're moving along quickly, in terms of the Guyana component, which is GAMIP, which is the Guyana Association of Medical Imaging Professionals. I hope I got it right.
Yeah.
I know you were reconstituted, your board was reconstituted sometime earlier this year. Tell us about, give us a little update on your progress and how, if any impact, if you had any impact as a result of COVID in terms of reaching your goals.
So we are looking forward now that we're somewhat stabilizing in the pandemic to have some in-person meetings. Part of our resuscitation process is to invite the entire imaging community to have an update on what's going on. We're going to be having 3 community meetings with all of the professionals in the country. We're hoping to have it done sooner rather than later. We're using guidance from the friendly societies through the Ministry of Human Services, and they're going to be helping us through this process. So we're looking forward to seeing everyone at these meetings, as many persons. I mean, when you work in healthcare, you try to manage that time, but we're looking forward to seeing everyone at these meetings. It's part of our resuscitation process, and we're trying to get that done sooner rather than later. But the pandemic has had to stall that because part of the requirements for those meetings is you have to have a sign-in done at the beginning of the meeting to document for legal purposes, how it was attended. So that has actually put that on hold. The pandemic has put that on hold. So as we're getting more and more persons vaccinated and we're able to actually meet in person now, that is going to be our next step.
Well, just moving along, Georgetown Hospital, I know you work there, and there's some improvements, some steps being taken in terms of getting the type of services offered there to another level. Tell us about that.
The other day I was joking with one of my bosses. I've been a GPHC since I was 17. I literally grew up at that hospital. I was there when we only had plain film x-ray with an analog system and probably one ultrasound unit. Now we offer a plethora of services. When you come to the emergency room, you can have a bedside ultrasound done, followed by your chest x-ray right there. Then you go to the radiology department, where you have mammography services being offered for free. You have CT services, you have fluoroscopic studies being done, and of course your x-rays. And this is all digital, so we no longer have darkroom issues as we've had in the past. With cardio.
What kind of issues?
Dark room. So, in the old movies where you'd go into a dark room and develop film, so it used to be like that, but now it's digital. So you have a monitor where you get to see all of the images, and all of the images are integrated into one software. So you can pull up, if a patient's had a CT or a mammogram or an X-ray, you can pull up each one of them that were done. So you just search for the name, or I think they use a MRN, a medical registry number, and you're able to find all of the studies that were done for as long as the system has existed. In cardiology, we offer transthoracic echocardiograms, transesophageal echocardiograms. That's the one where they put the probe, kind of like an endoscopy, except it's with ultrasound. And we offer pericardiocentesis in emergency cases, which is image-guided. It's an image-guided interventional procedure where I think the colloquial term is water on your heart. It's actually a medical emergency. So if that is going on, we have to drain that fluid fast, or else it can restrict the heart and cause it to stop beating. We also offer angiograms and stents at GPHC. So we have a whole plethora of services, and all of these are being improved daily.
I know that there's a lot of technology being developed, especially in your field. At one point, when you did an ultrasound, you could determine the sex of the baby and all of that. But now I see they're doing ultrasound. I'm not sure if it's here yet, where you can actually see the face.
Oh yeah, it's 40. I'm not promoting this in any way, but Balancing has been offering that for a while now.
Okay.
So 3D and 4D stuff, it's relatively new technology. It's very expensive technology, but it's amazing. For echoes, we don't have that currently, but it's amazing in actually seeing parts of the heart. I do believe our CT unit has 3D cinematic rendering, so you're actually able to see a 3D image rather than a 2D static image, and you're able to move it, turn it upside down.
So you're actually seeing what the heart looks like inside there.
Yeah.
Wow. Yeah, so that's a bit off topic because I didn't mean to...
the technology is amazing, and it's moving very, very fast. So
yes.
we constantly have to get training as well to keep up.
That is what I was going to. In terms of training, I know that... COVID, I know you would have attended a number of sessions, conferences overseas and so on. COVID has affected that. And how are you able to continue your work given what happens with the lockdown and the travel restrictions and so on?
I think because of how fast technology is moving in imaging, I felt more connected during the pandemic than anything else. A little bit too connected at times. But I was able to attend 2 conferences online. Most of the major imaging bodies are considering a hybrid option because traveling, you have to take time off, you have to go to another country versus when you're in a very limited, a very small field, it's easier to do it online, so you're not leaving the country. But yeah, we had some amazing sessions. Almost every conference or every session I've attended had a COVID component. I was excited this year. I was able to attend the Caribbean Cardiac Society conference for the first time. They're amazing. I'm totally fangirling over them because it's from the Caribbean and we're doing some amazing things. We're able to collaborate and speak with other persons in the region and see how the services are being offered. But yeah, definitely the COVID component has been significantly helpful in our decision making here because we know what's happening and we know how to plan for what's going to happen. But definitely we've been doing continuous training all the while. It hasn't stopped. It's just become virtual now. But we're slowly starting to go to a hybrid version where some of it is online and some of it is in person.
We know that there was some work being done in terms of drafting the Allied Health Act.
I am so sorry about that. Yeah, so we're actually working on updating that. We're trying to get a draft together. We want to include all of our medical imaging professionals. The field is not what it used to be. We have measured diversification of all the services, and we're having specialties. We're having people say, I can do this. If the other countries offer it, we can do it too, and we can do it just as good. So we want to be able to have those persons covered under the law and to have the services covered under the law. So it's not just about updating it to reflect what is currently being offered, but we also want to plan ahead for the future as we're having new services basically being put into the works or slowly being implemented. So that's the aim. The idea is to have it not just reflect current practices, but plan for our future in imaging here in Guyana.
And as members of the public, what role, how can we support? I know not just the medical imaging people, but the health sector in terms of helping you cope with what's happening with the pandemic.
Some patience. And that's like the first one. That backlog that was created, it was to try to keep everyone as safe as possible.
Yes.
We know our risk on our healthcare end. We know what we're dealing with, but we also want to keep our patients safe. I remember basically begging persons, and especially those who are healthy enough. It's not just you we have to think of. We have to think of the small child that's waiting for surgery, for probably open heart surgery. We have to keep them safe. We don't want them to get sicker or not be able to make it to that surgery. We have our transplant persons, and they're all across the age ranges. You have young persons with kidney failure who need a transplant. We don't want them to get sicker or to have their surgery delayed when it finally comes up. We have pregnant mothers. We can't risk putting them in any unnecessary situations they ought not to be in. We have our elderly patients, and these are persons who take care of themselves, but they have a medical condition. You can't put them at risk. And we have our chemotherapy patients. I think they have had it the worst because chemo was paused for some of them. And
now they're starting to get it.
Yeah, we're picking up again, but at the same time, the chemo basically suppresses their immune system.
Yes.
It makes them weaker. They can't fight.
Oh, wow.
And they deserve a fighting chance. My cancer patients are some of the best. They were the ones who made me smile the most during the pandemic because they were so happy to get their services. They were so happy to be able to go out and to not feel so scared. And we're trying to protect them as much as we're trying to protect every patient that's coming there. So as we're trying to come out of the pandemic, we're just asking for some patience. We're going to try to get to everybody. We have systems in place on how to address the backlog, but again, we have a very limited human resource in healthcare all across the board. We don't have enough doctors, we don't have enough nurses, we don't have enough imaging professionals, we don't have enough of people in the allied health. There's only so much a limited number of persons can do without hitting burnout, and many of us have hit burnout throughout this pandemic, and it's not nice because our burnout is not the regular burnout we've had. There are patients who die that we were rooting for. Because we do it for our patients. We want them to get better. One of the best things about working in healthcare is when that patient walks back to you and comes and says, hi, I remember you, and I'm so glad I'm able to feel better. And that's like the most rewarding moment. So we want our patients to recover. So just have some patience. We will get to you for all of your services. Doctors are guiding all of our protocols and triaging our patients. So it is being done methodically. It's not just randomly choosing patients.
And just before we wrap up, those who don't know or they weren't listening or they're not now at the end of the program now hearing us, what can you say in terms of the essentialness of your work for radiographers and medical imaging. Tell them why it's essential, and you can probably tell them why they need to get vaccinated and stuff like that. And before I leave, I was supposed to ask you earlier about, in terms of your awareness work, about World Radiology Day. I wasn't sure.
World Radiography Day, yeah.
Yes. What were some of the activities locally, if there were any, and what you did to raise awareness?
So we try every year to make sure that not just the general public, but decision makers, to get them to understand that we're a critical part of the healthcare team. Again, like I said, we're a very young field. Probably in the 50s. Yeah, up to the 50s, doctors were performing these procedures. Nurses were doing them.
Yes.
And it wasn't until we started setting up programs to have persons specialize in the field, that's when that started happening. So it's very, very new technology. And we're trying to integrate both patient care and our work together to make it easier for doctors to work with. Sadly, we didn't have any activities planned, mainly because of COVID-19. Everyone in our field works at a hospital, so we can't risk having too many face-to-face activities because you never know when a patient might test positive, and you'd have to go and get tested. But we did have a lot of online promotion. For the team, we had persons. I had posted a little bit about it. Our president made a statement. Our ISRT council rep did a beautiful statement as well, Mr. Nazruddin. And we try to support all of the initiatives from the ISRT in advocating for improved services, better working condition. And sorry, the other part about our place in the healthcare team. Sorry, just 1 second. My throat's a bit itchy.
It's okay.
So like I was saying, when you come to the emergency room, you have an extra exam done. Everyone in the emergency room has a critical role to play. And after those exams, sorry.
That's all right.
You have to have persons there to actually perform these studies. And in doing so, you can't take away from the services being offered. And doctors can do all of these studies. The bulk of the work is ours, but they do provide bedside services. And if we were to depend on doctors or nurses alone to add this onto their workload, our backlog would be monumental, because they also have their responsibilities and duties, and this would be significantly more than they can handle. And that's why we have persons in this field, and we have subspecialties. Hopefully in the future we'll have more than what we currently have, but it's an amazing starting step to have the ECHO program now being offered. It's actually been offered for a few years now, but it's now being accredited by the university. And hopefully in the future we'll have subspecialties in MRI, in CT. I am personally advocating for nuclear medicine. It's amazing what nuclear medicine can do, especially for cancer patients. Because they call it hybrid imaging now. So you're actually able to pick up stuff before it turns into like a huge tumor. And we also have radiographers who are radiotherapists. They guide radiotherapy procedures. So there's also, I guess, a functional part of it. So we have persons who don't just take photos. They actually help with treatment. In my case, for treatment, I provide image guidance for pericardiocentesis when they go in to get the fluid out from around the heart. So some of our responsibilities are overlapping with actual treatment options now. So it's more functional imaging than just the regular static imaging that you would have known. And Ghana is moving abreast. We're not falling behind. We're not, I guess the colloquial term, we're not taking left. We want to be there. We want to do it. And we have a very vibrant and young community. And we're hoping to let that translate into more services being offered to Guyanese.
Okay, so that brings us to the end of our discussion. Thank you so much, Ramona. I know your work is quite demanding, and you took some time off to get here, to be here with us this afternoon. To those who listen, thank you so much again for joining us via radio 99.1 and 99.5 FM. And via our Facebook page. on behalf of the Kaieteur Radio team, be safe, be good, and just keep yourself socially distant, vaccinated, and until we meet again next Monday for another edition of Your Health Matters.
The Guyana Elections Commission is inviting applications from suitably qualified persons to fill the following positions: Voter Registration Manager, Research Officer,